how do we treat sleep issues? Well, I look at this as like a line of defense. So my first line of defense always is going to be to work on sleep hygiene. So sleep hygiene is the way that you take care of yourself and prepare yourself for bedtime, right? Are you watching TV? Do you have the lights on? Those types of things. Are you on your phone? Is your screen on? Because all of that light can suppress melatonin production, and we often don't realize what an effect that could have on our sleep. So things to do for sleep hygiene: make sure you're dimming the lights before bed. Make sure you're limiting screen time. Avoid napping during the daytime, because if you're napping all day and then you go to bed and you can't sleep, you assume that you have some sort of sleep problem, but it's because you've been napping all day. So you try to get rid of that, get on a better cycle. And often when we're not working or not going to school, we nap during the day and we can't sleep at night. So we need to try and switch that so that we aren't napping during the day and we're able to actually start getting good night's sleep. Progressive relaxation techniques, muscle relaxation techniques, de-stressing, so meditation, massage, psychotherapy, cognitive behavioral therapy, anything we can do to suppress our anxiousness and our anxiety and kind of calm our mind and be able to go to sleep. I often recommend some meditation apps, trying to meditate before you go to bed. I find these very effective for myself, but also for others. So that's the first line of defense. Now, this sleep hygiene thing, we have this patient handout here for patients that we often give them, and this is kind of an evidence-based sleep hygiene routine. If you're interested in that, we're actually going to include this in this month's issues of the Concussion Chronicles. We're also going to include the new American Medical Society for Sports Medicine position statement on concussion in sports. So this is a brand new document that just came out a couple weeks ago. And we're also, like I said, going to include this sleep hygiene handout. So if you want to get your hands on that handout, just go and sign up for Concussion Chronicles and you'll get all the newest research. Every month we synthesize 2 or 3 or 4 articles depending on what's out there. So if you want that, sign up for Chronicles. After my sleep hygiene, my next kind of line of defense is now to look at supplementation, potentially with something like melatonin. So melatonin, it's a hormone secreted by the pineal gland, like I said, but it can also be a supplement that you can take exogenously. So talk to your healthcare provider about dosage and the correct application for how to actually administer melatonin. There are various forms. There's slow release. There's rapid release type formulations, and so you want to make sure you're finding the right one for you based on what it is. Talk to your healthcare provider about it, and they can prescribe the proper dosage and the proper type for you. There are some side effects to melatonin. It can increase grogginess the following day. It can produce headaches in some people, but the side effects are much less than in my third line of defense, which is actually getting into sleep medication. So sleeping pills should only ever be used, and this is the recommendation, should only ever be used for a period of 7 days. Using sleeping medication for any longer than that, it can create all sorts of side effects, and it can actually prevent you from having quality sleep without it. You could develop a dependency to these medications, and there's all sorts of other side effects like depression and suicidality and some other things that go along with some of these sleeping medications. So you want to be very careful when dealing with sleeping pills. So the recommendation is no more than 7 days. Often come with a ton of side effects, and sometimes if your sleep issues are due to anxiety, sometimes getting the anxiety under control, perhaps with some anti-anxiety medication, may be a better way to go. But again, this is something you'd have to talk to your doctor about to try and find what the best solution is for you. So I tend to start with the natural remedies, things we can do on our own to try and produce better quality sleep, shutting the lights off, sleep hygiene, that type of thing. Second line of defense, let's look at natural supplementation. Third line of defense, let's talk to your doctor about some pharmaceutical options for you.